So some of the other techniques that we use that are extra but super helpful are dry needling, and it's a lot like acupuncture, but it's using more pressure points. So tiny little needles to help reduce that pressure and that tension. We use Graston, which is a long metal tool, and we kind of scrape the muscle. I found that to be super helpful in headaches and whiplash, things like that. So tension headaches, we use that a lot on these small muscles, the hard to get at muscles. We use the Graston technique. We also use SASTM, which is sound assisted soft tissue mobilization. It's more of a plastic tool, but essentially they do the same things. In clinic here, I also use cupping, which are these little suction cups that we can put on specific muscle groups. They stay there for a while. So it's a reverse pressure. Instead of putting pressure down on the muscle, it pulls pressure up. And so it reduces scar tissue, it brings in good blood flow to help healing, reduces any inflammation that's in the area. So we've had a lot of success using that as well. So all of these things play into reducing the muscular and the bony structures, the tension in those things that cause headaches. And we know there's a lot of reasons why we get headaches, but today we're just touching on, with physical therapy, the muscular, nerve, and the bone issues that you can have that cause headaches. So also, on a side note, when we're talking about wellness, and we talk with our patients about this a lot, stress and headaches can cause other issues, such as high cortisol levels. And high cortisol levels mean there's a lot of stress, and so you're in this fight or flight position in your body, and so you're just always on the ready. So high cortisol levels can cause headaches as well, and you can speak with your doctor about that. But just different ways to reduce that is a lot of stress management and vagal nerve stimulation. So just to touch on a few, one of the things that I teach my patients is not only belly breathing, but to stimulate that vagus nerve. So we put one hand on our heart, one hand on our belly, and when we breathe in through our nose, we want our belly to rise, and then out, we want our chest to fall. And it also helps us have that pressure right in our heart area, and so it stimulates that vagus nerve, which is going to reduce that fight or flight feeling, and therefore reduce cortisol. So another thing to stimulate that vagus nerve, which would be the parasympathetic system, is at the base of your skull. You're going to put some pressure. So you can either have someone put their fingers under there, or you can put a ball or two balls that are together in a sock or a nylon, and just put it at the base of your skull, lay on it, and it'll put pressure right at the base of your skull, and therefore stimulate that vagal nerve, and then it will reduce cortisol levels and that stress and things like that. One of the other things that's suggested is just a light hum, and that vibration in your body can also stimulate that vagus nerve. Another thing we touch on a lot in physical therapy is if you are working at a desk job, is your posture. So a lot of times I tell people to work from the bottom up. When you're sitting at your desk, put your feet flat on the floor, and you should have a 90-degree bend in your knees, and then you're sitting so your thighs are parallel to the floor. Sit up tall, and you don't want to think about pulling your shoulders back necessarily when you think of good posture. I like to think of kind of a hook on your chest, and you're lifting your chest up and everything is stacked. So once you've done those things, then you look forward, and your computer should be right in front of you. If it is not, then you make the necessary adjustments in front of you, and you can also adjust your chair. So oftentimes we're in a position in our office where maybe we can't get the equipment that we need to change our computer, and I see this a lot with women. So instead of starting with where your feet are on the floor, I tell them to start with where your chair is, and then work your system around you, and then just take a box and put it under your feet. So there's a lot of different things we can talk about as far as posture and ergonomics at the workplace, which will help with better posture and reduction of stress, headaches, and having your head going forward or reaching forward for that keyboard when you're sitting at your desk. All of those things can cause stress and cause stress headaches, so we want to kind of get to the root cause of that. All right, another way that we can combat stress headaches is make sure you are well hydrated. So in general, drinking half of your body weight in ounces of water is optimal, if not all of your body weight. It's tough to do that, but it's super important to stay hydrated. It hydrates your joints, it hydrates your skin, helps reduce stress, all of the great things just in water. Getting fresh fruits and vegetables, shop the perimeter of your grocery store, stay away from processed foods or foods that have dyes in them. Getting proper sleep 8 hours of sleep, 7 to 9, depending on what your body needs. And then stress management, which we kind of talked about before, and I'm sure a lot of the other providers are going to have excellent techniques of how to manage stress pertaining to their specialty. Another thing we talk about in physical therapy are sleep positions. So 8 hours a day, you are resetting your body, optimally 8 hours a day. You are resetting your body and you are teaching your body a position where it can completely relax. So if we are sleeping in a position that is not comfortable and it is not optimal for our spine and our body, then we are not going to have that reset that we need, and it's not going to help us have that stress management or the reset that we feel the next day after a good night's sleep. So one thing I talk about is making sure that our neck is supported when we're sleeping. You can even take your pillow and curl it under your neck, so you kind of have just a little bit of extension in your neck when you're laying on your back. You can use a contoured pillow if you would like. Another thing to watch for is if you are a side sleeper, you don't want your head reaching for the bed. You want it high enough that it keeps your spine in alignment. You don't want it too high where you're kinked to the side. So you really need to play around with different pillows and what works for you so you have good alignment at night. So when you are sleeping and you are resetting your body, you're putting it in the best position to reset so you don't wake up already in pain and stressed, okay? Another thing you can do with the pillows is when you're laying on your side, kind of hug a bigger pillow. That way your arm isn't reaching down to the bed, causing a pull on your neck as well. So there's a lot of different things we can talk about with that. And that is what I have for you today. So thank you so much for joining us. There's just so many things we can talk about with stress headaches. I hope this gave you a good insight of what physical therapists can do and how we can help you. We would love to help you. Brittany at Velocity Physical Therapy. We have a couple other therapists here as well. Give us a call and we can help you out, 715-716-5191. Thank you so much and have a stress-free day.